virtual. Pardon me, my phone was ringing. This is the third of 4 virtual seminars. You'll pardon our little delays, we're having technical difficulties, but here we are. Today's topic is staying sane, spirituality and mental health in COVID-19. And our speaker is Dr. Fuad Khan, who joins us on the screen here. My name is Julian Olivier. I'm chaplain here at Wentworth-Douglass Hospital, and my colleagues are Karen Wetmore and Michelle Guest-Lowry, and I will all be working with you. We'll all be your hosts. And my phone is ringing again. The advantages of these webinars, all kinds of noise. Please note that for this webinar, the chat feature will not be used, but we do welcome your questions. So please use the Q&A button, but feel free to chime in at any time and we'll be monitoring that. So let's talk about our subject. With the pandemic, people are experiencing all kinds of painful struggles, health crises, isolation, grief, stress, anxiety, job loss, financial problems, and on and on. Recent articles point out the effects of the pandemic that have been more than just physical. One study is entitled "Pandemic Stress Takes Its Toll." Another focuses on providers, doctors, lonely and burnt out in COVID-19. How has this pandemic, how has COVID-19 affected you? According to the Centers for Disease Control, fear and anxiety about the new disease and what could happen can be overwhelming and can cause strong emotions in adults and children. Public health actions such as social distancing, or I prefer physical distancing, can make people feel isolated and lonely and can increase the stress and anxiety, although these actions are necessary to reduce the spread of COVID-19. So how can we all, individually and as a society, cope with all this stress and come out of it, not only alive, but stronger? That's the question. And to address that, Dr. Fuad Khan.
Hello, everybody. Thank you very much. And I noticed that
Dr. Khan is the medical director and chief of service of behavioral health at Wentworth-Douglass Hospital. Besides his medical degree, he also holds a master's degree and MBA in health care and administration from the University of Dallas in Texas. Dr. Khan comes from a family of psychiatrists. After finishing medical school in Pakistan, he came to the US by way of Harvard. Here he completed psychiatry residency and fellowship in psychodynamic psychotherapy. Returning to Pakistan, he developed a psychiatric hospital system and a psychotherapy training program. And currently, he was avidly involved in philanthropic work, especially disaster relief and the care of burn patients. In 2009, after a stint in New Zealand, he returned to the United States, working now with Beth Israel Deaconess Medical Center and as a faculty member at Harvard Medical School. Following an invitation to become chief of psychiatry at Parkland Memorial Hospital, he moved to Dallas, where he helped shape the psychiatry services to become one of the best in the region. He remains affiliated with the University of Texas Medical School as an associate professor of psychiatry, and he continues to supervise residents there. Dr. Khan joined Wentworth-Douglass Hospital in November 2017, and he's been involved in several initiatives to improve the mental health care delivery in the Seacoast area. His work focuses not only on improving psychiatric practice, but also on increasing mental health and awareness, both in the medical field and in the community. Dr. Khan's presentation will be followed by your questions and discussion. Please use the Q&A button. My colleagues will get to as many as time permits. Welcome, Dr. Khan.
Thank you very much, Julian, Karen, Linda, and Michelle, for making it possible. It gives me great honor and great pleasure to be able to speak on this this conference, and I've heard so many good things about it. I hear that it's one of the best conferences around, so it's a great pleasure for me. Let me share my screen, and we can go from there. Can everybody hear me and see my screen as well? Okay, perfect. So, this is a big topic, and I am not a expert of, either spirituality, religion. I don't even call myself an expert of psychiatry or psychotherapy also, because there's so much more that we don't know. So we are all students of this. Julian introduced me. I've put a picture that I took many years ago in Pakistan, and this is my spiritual haven where I often dream of returning. It's a mountain where I find that every time I had struggles with anxiety or depression, I found the solace and comfort of mountains as a place where I could rejuvenate, and because I could be away and I could immerse myself in the quietness. With this, let me begin with the idea of what is really sanity. And so our agenda will be a little bit of talking about what is sanity. I don't want it to be a kind of a proscriptive or prescriptive discussion where I'm saying you do this or you do that, or you don't do this or do that. My interest in here is that can I from a personal perspective, from a perspective of being a therapist and a psychiatrist, can I share some of my thoughts and ideas about what I think goes on in the mind of the human being, what are the innate fears and anxieties, how humans find comfort and solace, what's the role of spirituality, medical science, and what has this COVID-19 done to us? So, what is really sanity? In my view, from a psychiatry standpoint, when somebody once asked me, what is psychotherapy all about? And I said pretty much exactly this. Sanity is all about accepting yourself, accepting reality, finding out that hope is always there, somewhere around there. Sometimes it doesn't look near, but it is always there, and finding a way to it. And then another thing is very important thing is that people run away from depression and sadness. In fact, I make a little distinction as a psychiatrist between sadness and depression. Sadness is a very normal human phenomena. Sadness is something that you should have if you have had a loss, because that's a normal human emotion. Depression, in contrast, is when you cannot process that sadness, cannot experience it fully, cannot immerse in it, and then let it go. You've seen little children, they can easily cry, but then they can easily laugh the very next second. Those of us who cannot cry a loss continue to dwell in it, continue to struggle in it, and it takes forever for them to come out and laugh. And then one of the most important things that is mainly the central part of our talk today is a sanity is, or a balance is, when you have comfort with an uncertainty. There's a saying that what's the most certain truth of life? And one of the most certain truths of life is that you will die. What is one of the biggest uncertainty is when, how, and where. So let's just assume that from a psychiatry, psychotherapy, and my own personal perspective, if sanity is all of this, how it is manifested in the human beings. I kind of divide it into two ways. One, a kind of an instinctual fear, an innate fear that we have. And then as we grow and become sophisticated, our faculties grow, our intellect grows, our emotional growth happens, you know, like when they talk about intelligence quotient and emotional quotient. When they grow, we become a little more philosophical. We become deeper in our thinking. And they add another level of unknowns and fears. So if you look at the direct instinctual fears, one of the biggest fear is the fear of the unknown. Am I going to live? Am I going to die? How, when, where? And the annihilation fear, the very, very early fear of all species is that I will be exterminated, and how to fight that. Then comes the other level of fears that are after the first level, which is, will I live or not? But the next one is, will I be lonely? Will I be alone? And you know, they say the biggest punishment is the punishment of isolation or solitary confinement. And then there is another fear. I want to be able to control something. I want to be able to control my fate. I want to be able to control my life, my health. So a sense that I don't have control is another fear. And in the philosophical realms, you know, when we start to become a little more in control of the original instinctual fears, you know, we deal with these other fears. What's the purpose of life? Why am I here? What's this all about? There's an emptiness, meaninglessness that kind of nags at people all the time. When you're busy with things and distracted, it may not, but deep inside, every human being has the ability and the intellect to and capability of thinking these, and many times we do. So how do we solve these? You know, human beings are very creative. They're also very sometimes stupid, you know, but let's put it this way. You know, there's a famous writer, Yuval Noah Harari, in his book, Sapiens, he wrote, never underestimate the level of human stupidity, but never underestimate the level of human creativity as well. You know, we deal with these things. We seek various things. So for the fear of the unknown, we seek an explanation about why, where, how. About the fear of annihilation, we develop a mode and a paranoid stance. I'm not talking of paranoid delusions or psychosis here. A paranoid stance, a preparation for saving yourself. It's a very natural phenomena, and people work towards it. Loneliness is managed by learning methods of attachment, of learning to develop a belonging and developing an identity. An identity, for one reason or the other, human beings have not come out of this anxiety that we cannot attach unless we have an identity. I don't know if it makes sense, but you know, we seek attachment and belonging through an identity. If I am such and such, I will be accepted by this group. I must have an identity, and people struggle with identities. And then, you know, we want to control, and many times we want to control in manners that remind me of, you know, a few jokes where, you know, somebody just does something very strange and disconnected, but it gives them a sense of control. And you know, in patients who suffer from obsessive compulsive disorders, it gets magnified to become a problematic situation. So many of us would seek material gains and financial gains, and we say, oh, you know, we are squared away our money, we squared away our property, and that gives them a sense of control. In the obsessive compulsive disorder, it goes way beyond, where you start doing things that make you feel as if you have control over something. And in, for example, eating disorders, where people tend to restrict their food, gives them a sense of control over them, when the actual reason for that anxiety or turbulence or distress, it has nothing to do with food control. It may be a trauma in their life. It may be an impending loss that they're fearing. So again, human beings tend to look for things. Now, I want to talk a little bit about religion for a second. Religion and politics are always dangerous things to talk about in public, So I have to be very, very careful. But there's I was looking at various, information sources, and there's about 4,000 plus religions in the world that have been identified. Christianity, the biggest one in numbers, Islam, the second one, and actually the third one in one of the resources I looked at has been listed as having no religious affiliation. So they kind of put people who said, I have no religious affiliation, agnostics, atheists, they actually are number 3 in total number in the world. And then, Buddhism and Hinduism and all come down in the sequence down there. There's monotheistic religions, polytheistic, dualistic. So, there's many religions, but there's one major thing that the religions are very helpful to our people. We are not getting into which one is right, which one is wrong, because I feel personally that every one of them is right. But the most important thing the religions gave to people to manage these fears that I listed before, religions give you an explanation of life. The unknown gets a little tolerable. You have a purpose. You have a sight even beyond what you may think of the final end as death. So you get those things. And religions also not only stop there by just giving you an explanation, they also give you a code, a conduct, a method to get there. All religions provide a ritual portion, and all religions provide a spiritual portion. The style may be different, but in general, religions can provide peace, comfort, and acceptance. I was looking at a lot of studies. What has science done to evaluate, do religions provide comfort in psychiatric illnesses or anxiety or depression? There's so many studies out there, but thinking from a very scientific perspective, it becomes very hard to say yes or no, because religions, how do you define who's religious? Is that somebody who just believes in God and is religious, or believes in a deity, or somebody who must be practicing, or somebody who must be avidly a church or a mosque or a synagogue or a mandir or a goer to those things? So when I looked at a lot of studies, it sounded like, oh, you know what? I really don't know anything, because some studies said presence of religion, and this has been shown in some studies, is cancer patients actually have a better rate of recovery if they're religious. Religion is helpful in protecting people from substance use, from deviation into practices that may be seen as reckless, bad, gambling, promiscuity and things like that, or can bring them harm. So, it is there. Now, why I wanted to talk about religion is because within the religions, there is a problem also. Religions are very susceptible, not because the religion original essence has a problem, but like anything, a knife can be used to cut vegetables, but also can be used to stab. And religions provided an option, what I personally call the pollutant of a religion. The option it provided was that it provided an identity and a potential to group together. And human beings are pack animals. We can't let go of that instinct. So you could see in history, history is rife with explanations of where kings used to say, I'm related to God, or I'm part God, or something. All the way to the pharaohs of Egypt, to history, many parts in history. Also, a lot of religious groups and leaders started to become very powerful. You see that in modern day Islamic militarism. And when I come from Islamic background, grew up in an Islamic society, and reading religion made it very hard for me to understand what are these guys talking about, that has nothing to do with the religion I was taught. But it's about power and politics, identity and grouping. And sometimes religions, when they actually become intensely proposed by somebody as very intense, like, you must have heard that sentence, despair is sin. Now, despair is sin is a very, very powerful statement that can go this way or that way. So a person who's mildly in some despair and is religious will say, it's a sinful thing to think that way. I'm going to motivate myself and work hard to get out of this. A person who is bottomed out with despair may not be able to think of the hope to get out of it, but may start to think that he's sinful and condemned. So, things like that. So there was a study that said in religious experiences where religion was very intensely and with extrinsic punishment, it was coupled with it, there was more depression and more anxiety among religious people. So anyway, at this state, I wanted to say a few things here, because within the religions came out the spirituality, so the word spirituality comes out of, Christian thinking, and the Middle Eastern religions and Eastern religions and others all contributed to the way spirituality evolved. And, in religions, the spirituality evolved around linking yourself with a deity, a god, or connecting at a higher level. But the main theme was, they were all united on one thing. It was a search for meaning by getting into yourself and finding a harmony and peace within yourself and then connecting. So if in the Christian or the Muslim, traditions of mysticism and Sufism and spirituality, you could feel that you're connecting with your loved prophet or God or saint or anybody. The Eastern religions could do it the same thing in a slightly different way, where you could focus on a light that in itself did not have a religious significance or something, but it allowed you to immerse into your own self. And this began the whole process. And then came other aspects. Jalaluddin Rumi was a Persian mystic. I've been very impressed with his writings, and I've actually visited his shrine as well. And it was very interesting. And I saw this, and he just put it down like this: the lamps are different, but the light is the same. And you could see that, in his descendants, if you go to their shrines or you go to their places of worship. Once I went to a place in Turkey, and I saw all religions, even atheists and agnostics were sitting there, and they just wanted to learn the meaning of the inner self. Now, one more important thing is that we have to understand, and as I see it, there's only one illness in the world, actually. There's not more than one illness. Everybody's going to die. Everybody's going to wither away. Everybody's going to become old. But there's one illness only, which is pain. And it's either physical pain or mental pain. If you have an injury, but you're not hurting, it's just a process. It's just a method, and the skin will repair itself, the bone will heal. If you have pain, you have distress. Same thing with mental pain. An Andalusian scholar, Ibn Hazm, said that, he searched for a common goal among humankind to which all would agree. And he said, I've not found anything other than vanquishing of anxiety. And, once I was traveling in a taxi in Europe, and, the driver said to me, what do you do? And I said, I'm a psychiatrist. He said, oh yeah, no panic, no problem. He said, my life is all about that. If there's no panic, there's no problem. So the question is, we all look at it from very many different angles. So anxiety and depression are some of the biggest factors. The other day I was reading the numbers. There's a 30 to 40% chance among youth to a lifetime prevalence of having at least some anxiety or depression that may need treatment. Now we come to medical science. Medical science in its original start, or especially psychiatry and psychology, where logic and scientific method was the main thing, initially they started to have a lot of rejection of religion. And within that, a rejection of spirituality also. In fact, Freud, for example, who was the founder of psychoanalysis, at one point rejected it by saying religion is the neurosis of the masses. And then there were people who went as far as saying religion causes psychosis. So within that, not only religion, but spirituality that was also very closely associated with religious thought was also condemned. But over some time, science also has had its problems. I was just recently at a conference and I realized very, very interesting finding that, a lot of illnesses we think we're treating with medications and saving those patients, sometimes actually the illness has just come out of its own phase. And we are like, oh, boom, we did it with medications. Actually, it has come out of its phase. Maybe we assist it a little bit, but are we doing everything? Well, no. So, psychiatry itself went through a lot of crisis. There was a big war between psychiatrists who thought of only biological psychiatry. They said dreams are useless. Dreams is just some state of craziness. There's no concept of therapy. And there was a lot of struggle, political struggle between different camps. But over the years, we have all come to understand one thing, the diathesis model. The diathesis model is there's a genetic proneness, and then there's the environmental exposure to something. So if you are prone to having a heart disease and you smoke, you don't take care of your weight, you lead a sedentary lifestyle, your chances of developing a heart disease earlier in life and more intense are heightened. Same thing for psychiatry. If you carry a gene for schizophrenia, and I want to say it very loud here because I want to reach all audiences for this particular statement. If you carry a gene for schizophrenia, and if you think that medical marijuana is a fantastic thing, I tell you, research shows that people who expose themselves to high potency marijuana, THC, can unleash their gene and you will have schizophrenia for good then. There's no turning back. It's not an intoxicated state that will go away. It's open now. Same thing for depression, early childhood trauma, subtle trauma, repeated trauma. All of these will turn out as a poorer result in people who have a genetic loading for that disorder. So we understand that now. We are also starting to understand a lot of other things. Scientists have stopped fighting a little bit, thank God. And psychiatrists too. There's a lot of discussion about mind-body interface. The work of John Kabat-Zinn and on telomeres, that telomeres are structures in our human body in a very simplistic way. Their length is associated, the shortening of their length is associated with aging. And they've said that, on different studies have shown that if for 8 weeks of mindfulness and meditation and a slight change in lifestyle can actually lengthen the telomeres back. So that may be a protective effect of just mindfulness and meditation. Psychotherapies making use of mindfulness, stress reduction or cognitive therapy, the concept of how society and social systems support that are, they're all coming out, and EMDR and value of compassion. These are science has started to see them in more objective light. They're not discarding it anymore. The current trend is, for example, the American Psychiatric Association has published a guide for faith leaders to help them help their patients who may have mental illness. And, it's a contribution of all the religious people and psychiatrists. And then, the World Psychiatric Association has a section on religion, spirituality, and psychiatry. And, the American Psychological Association, for example, one example is, Kenneth Pargament's book, the American Psychological Association Handbook of Psychology, Religion, and Spirituality. It has started to dawn on humanity that we're not looking at what's the real truth. We're no longer fighting about that. We're fighting about what works and how does it. And we're getting together on that. So just to summarize, current day understanding of spirituality as it evolved from the religions and from mind, body, meditation, yoga, and then scientific approaches to looking at telomeres and mindfulness-based stress reduction kind of models. The current understanding of spirituality, whether it's coming from a very religious angle or from a very non-religious angle, it has found itself to become an kind of a conceptual sense of stillness in you and letting go. It starts with noticing of yourself, where you are, how you are, and then learning and acceptance and appreciation, not just acceptance, but an appreciation of your body, of your mind and feelings, of the world around you, and of your uniqueness. I'm not going to name the figure who said that. He is a controversial figure, but he said something very interesting and very nice. He said that people need to learn that I'm not superior or inferior, but I'm unique. I am me, and you are you, and that has no judgment in there. So and then what I want to say is the letting go of the need to control, the letting go of the need beyond our ability to know everything. And finally, I want to say the last sentence on the slide, allowing yourself to experience sadness. Many times patients come to me and they're trying to run away from sadness. And I say, you have to go through this river of sadness to come out on the other side. It's just because it's real. It's real because you had a loss. So we have to think of allowing ourselves, all our lives, our mom and dad tell us, strong boys don't cry, good girls don't, cry. And then the psychiatrist says, oh, why don't you cry? And it is because we're trying to help people relearn the experiencing of sadness. Now, Mr. COVID arrived without without any invitation. Mr. COVID came around to the world. And, if I go back to my original slide, it is probably a replication of this slide. COVID came around and hit the society very hard. What it brought to us was it hit us from multiple angles. First of all, it brought us an uncertainty which is there till this date. We still don't know who is more susceptible, who is less susceptible. We don't know if we will have a good vaccine. We don't know if it'll go away. We all are saying, so I hear people saying, oh, once the COVID is over, we'll do this. And I'm like, wait a second. Where did you get that notion that COVID is over? I mean, that's like setting yourself up to a disappointment, maybe. It may get a little bit in control, but I'm not sure if it's going to be over. But we will learn and find a way to handle it. So again, uncertainty, fear of death, fear of the death of self, loved ones, children. And not only that, the paranoid fear that I may get it from you or I may give it to you. It just hit us there because there's almost no guarantees anywhere here. What it did further worse was it hit our defensive mechanisms like I had described earlier. It hit us where we find comfort and solace. We like to attach. We like to be in social circles. And we like to be with people. We like to go to our worship places. We like to go to our schools and playgrounds, have a party, go to a sports, gathering, to our malls and restaurants. It snatched them all from us. I have a patient who's 82 years old, wonderful fellow. He's suffering from depression for another reason. He had a tragedy. But now he's struggling because his favorite places in life were Home Depot, Lowe's, and going to have a cup of coffee somewhere and go to a restaurant. And he says, I cannot go because he has a lung condition. So we've been working on how he can do some of it, not all of it. And then I want to talk about that symbolism of language. A while back, and Julian alluded to it, just a few minutes ago, about physical distancing and not social distancing. I had spoken about it, when I was asked to put up a little video presentation on this. I felt that, are we going too quickly into finding a word that personally felt to me as a psychiatrist that maybe have we said the wrong thing a little bit. Anyway, I'm not going to challenge anybody on this, but I feel that social closeness is very important. And many of us have been forced into this kind of connections, over Zoom and everything. And, it's just, I heard of some doctors who used to play music and they stopped playing music. And so when I was talking to them, I said, why don't you all three sit more than 6 feet apart and just play your guitar and drums? Just go and they started doing that. And they went into their, they would join together in a driveway of one of the friends and then sit at least 6 feet apart. With a big musical instrument, you're 6 feet apart anyway. So they started doing that. So, human beings are very creative. There's 2-3 ways of approaching this uncertainty that Corona has brought to our world. And then, everybody finds a way to further pollute it. Somebody says it's all lies, and the other people are becoming obsessive about it. So, it just makes it more complicated. But I would like to emphasize again the concept of spirituality and some other pragmatic approaches, like going and meeting each other in the driveway. In the wintertime, it will become harder, but it still can be done. People will find a way. But also spirituality is very important because we in our world of materialism get immersed into objects and things. But we forget that there's an inner peace, and that inner peace can come from any direction, whether it's a religious direction or if you're not religious, then from an inner appraisal, acceptance, and appreciation of yourself. If we accept this is the reality of our world, it will be easier rather than every single day we wake up and saying, when is COVID going to be over? I don't like this world. Well, let's just accept the world. This is the way it is. Let's thank our fate, our gods, our non-gods, if we think that way. But let's just accept that and be thankful that it's not worse. There's not another COVID happening, a different type of COVID. We're not in a world war. We're not in a state of ill health for other things. So an acceptance sometimes goes a long way. It just makes the same glass look half full now. Uncertainty will always be. There will always be uncertainty. Some things will just make it look more intense. And let's accept that, this loneliness that it has created, especially among single people. I actually was surprised when I started interviewing people that there were the young doctors who were single were hit the hardest actually. And especially because they had this confidence that we're young, we don't have a health problem, and we should be able to handle anything. And then suddenly their lives, or they come back all the day wearing masks and shields and not even looking like, they're looking like astronauts now. And they come home and they don't have a restaurant to go to. They don't go to play golf. They don't go to their gyms. They don't go to their friends. They're not married, so they don't have kids at home. They come and they sit in front of the TV and munch on their food, which doesn't taste good anymore. And that they were hit the hardest. The others who were hit the hardest were people who lost a family member during this time, not because of COVID maybe, but for any reason. And especially older people whose kids had flown away from the nest, and that two older couple were living, and then they suddenly lost one of them. It was just so hard for them because they couldn't see grandkids. The grandkids were being kept away so that grandpa doesn't get anything from you. And the grandpa is dying of sadness and isolation. So, it was very distressing. But so, there's always a way. We human beings are very resilient, but it starts with acceptance. It starts with appreciating that we are sad and let ourselves be sad. But let's just give ourselves that time to be sad so that it passes and we can go forward. And I think that's it. It's a big subject, and I had to struggle to make sure that I don't stray. I have a habit of straying. So I also want to just say one little story thing. When I left America, I went to Pakistan. I had this passion to develop psychotherapy there. Everybody told me it's not going to happen because it's a very American or Western thing. And, within few months, I was booked. And within a couple of years, it was booming. I came back. I lived in New Zealand for a short time. Then I came back to America, and somebody asked me, what's your experience? The cultures that you've lived in are so very different. I said, but the core values are the same. You have different languages, different styles of the expression. You just have to learn to speak and hear the emotional words, not the language words. And that's so true. Even within the same culture, people experience the same trauma as differently. I had one physician who told me, when I asked her what her experience of the current COVID situation was, and she said to me, it reminds me of where I came from. She was an immigrant from the Russian states. And she said, when we had a very tough time there, we used to stand in lines for food outside the grocery stores. It brings me those haunting memories back. That are we back in that world? And then there was this other doctor who said, I can't even go to my gym. And so he was struggling with that. And so, and somebody said, I have a grandparent at home, and every day I come back home, I'm petrified that am I going to give it to him? So everybody saw this COVID and as their COVID, different from another person's COVID. So I'll stop now. I think I've spoken enough. Thank you very much.
Thank you. Thank you very much. Now, don't go away because Karen's been watching the questions. Michelle, Karen, can you come in? Have to unmute.
Yes, Julian. Thank you. Thank you, Dr. Khan. That was terrific. And I'm looking forward to continuing this conversation. One of the viewers writes this question. I've seen the increase of medical cannabis for patients with PTSD, anxiety, depression, and bipolar disorder. What is your experience with this? Thoughts on using it as an intervention?
That's a very good question. First of all, let me just tell you, all across United States, the studies that we are aware of, and actually the whole world, the substance use level has gone up, depression and anxiety has gone up, alcohol use has gone up. So remember this, under these strains, there are other pillars have crumbled of our social supports and safety and certainty or uncertainty balance has been shaken up. This other thing has gone up. The increase in medical cannabis, we in this world of a fast pace, this is my personal view, and I will back it up a little bit with some of the scientific research. I was just actually in a conference on medical cannabis. So it's, first of all, we as human beings live in a world of immediate gratification. I say the art of being solid in yourself is learning two things: ability to tolerate frustration and ambivalence, and ability to delay gratification. We as a world have no sense of that anymore. We have lived in an affluent world where if we wanted to eat a piece of cake, you just get up and go and get it. If you want to go get an ice cream, you go get it. It's just no concept of postponing. So medical marijuana or marijuana came around and some people thought that maybe it has a medical value. God, all of the Americas now pitched into the idea that medical marijuana is so good that it actually, if you put it in the gasoline of your car, the car will drive faster. So there's an extraordinary fantasy about medical marijuana or cannabis. The studies show, and there's one good thing about the legalization, that's a crazy thing. I'm sorry to say it this way, but there's a crazy thing that unless a thing is legalized, it cannot be researched at a medical level. So the legalizing helped people do the research. There's almost like 22 ingredients of cannabinoids, tetrahydrocannabinol, and all of that. There's a lot of studies going on. So far, the data is very scanty. It has shown that it works in nausea, especially in cancer patients. It works in pain and appetite loss in cancer patients. It has some other benefits in some small disorders, but beyond that, it's a fantasy at this time. So, it's like, when patients come and say, they don't come to discuss. If you notice, these patients don't come to discuss what their problem is. They come to discuss their solution. So they don't come and say, I have anxiety. They usually say, I need medical marijuana. But that's an extreme level. But I am very careful with accepting that medical cannabis is an answer to everything. Yes, it has some benefits, but we are in the process of researching that. There's good, big studies going on, and let's wait for the verdict.
Thank you.
Yes.
To go off on a side note for just 1 millisecond, I had a friend who had dementia. He was in his 80s. He was slowly approaching the end of his life, and he lived in Massachusetts, where you can grow your own. And his family would grow the marijuana, create candies out of it, and the fellow would eat this stuff, and his doctor was thrilled that he participated. He was convivial. He would participate in what was going on around him. He did not suffer a loss of appetite, and he did not experience physical pain that that is to say, experienced it, but it was moderated by the cannabis. And what dawned on me when I went to visit him was that this may be something for our aging selves that might be quite helpful. Any comments on that?
Yes, I mean, there are many reports like that, and all of them are being researched with a lot of positive attitude and positive fervor. And I think what I'm saying is that I've seen anecdotally, I have patients who actually benefit from it. I have patients who believe it benefits them and it doesn't. I also know of several of my patients who had cancer and they lost all appetite, and the only thing that worked was cannabis. So I think the stuff looks promising. In fact, the cannabinoid portion of marijuana looks quite promising in many things. It's just that they're trying to find the right doses. And actually they're looking at some of the doses, and what my understanding at this time is, I just got a notice on time, but so what we know is that the doses that may be productive are higher than what we think we have. Another word of caution is that, in this conference, they actually were very, very forceful about saying that, people are growing cannabis and selling it, and they've been finding pesticides and its influence in cannabis. So you have to be very sure that you know where the source is. The other thing that a lot of websites that are selling marijuana, they looked into them and they tested their ingredients, and they found that 60% of the sold marijuana did not have what it proclaimed to have. And in fact, in like 12 or something percent, they actually found K2, fentanyl, and methamphetamine, and no cannabinoids or no THC. So we just have to be careful, because it's just a very unknown at this time. I'm pretty sure we'll know very quickly. It's a lot of research going on it.
Or USP may someday apply to marijuana or THC. So there's some control, manufacturing control.
Yes. Unfortunately, they don't have any regulations on that at this time. I think
another person asks about how marijuana might play a role in depression, anxiety, and schizophrenia. Well, you did speak to schizophrenia.
Well, in schizophrenia, I say stay away from marijuana, although research shows that most schizophrenics, or many schizophrenics, actually like to use marijuana because it eases them in some way. It may worsen their illness, like alcohol. You know, too much use of alcohol actually generates depression. It promotes depression. But on the surface, it reduces anxiety and maybe makes people feel good. I would just reserve my opinion at this time, because not enough is known for me to scientifically say that. Anecdotal reports are very many, and both positive and both negative. I think there's one more question about the effects of those who do not wish to embrace a spiritual life. Have you seen a significant difference between one who is spiritual and one who's not? It's a complicated subject. I think spiritual, I have not ever seen anybody who has said that I do not want to embrace a spiritual life. I have seen many people who say I do not want to have a religious affiliation. And I don't want to grab a spiritualism through a religious line. I've seen those people. I have not met people who will openly not want to have a spiritual life unless they're connecting it with religion. I don't think we have enough studies, scientifically speaking, to say what is the effect of spirituality, even though, you know, this mindfulness-based stress reduction and all of these other things are saying that it has positive effects. But, you know, the subject is so complex and vague. What is spiritual to me, it may not be spiritual to Julian or Karen. You know, it may be, they may have their different takes on that. So for science, you know, we are limited with finding very concrete things. We can check the blood pressure and measure it, but we can't measure the level of satisfaction or the level of beauty. We cannot say the beauty was 25. So the same thing is with spirituality. Since we don't know how to really define spirituality, we are a little time away before we can say that we know how to even measure and relate it to something. So I'm sorry, I can't really answer this question. If you ask my personal opinion, I think a lot of people that I see who seek spirituality have begun a process. I don't know if it will deliver it for them or not, but they are doing at least one thing. They're trying a new thing, which is a sign of hope.
Dr. Khan, if you have time for one more question.
I have time.
Okay. You know, during this time of increased vulnerability and uncertainty, sadness and anxious feelings are certainly abounding. What are signs that for people to watch for, indicating a movement from situationally appropriate feelings to anxiety and our depressive disorders?
Thank you. A very good question, because it really is it's something that we can all grasp.
Mm-hmm.
You know, a long time ago, Nike perhaps paired up with something, and they started measuring the number of text messages that people would do.
Hmm.
Somehow their prediction was that the number of text messages sent were associated with the measurement of their depressive states. So people who were becoming more depressed were sending less text messages. Now, right here, it gives you the idea that the earliest signs and symptoms for me, when I am looking at a patient or a person who I know, who I am suspecting is starting to become depressed, is their starting of giving up. So the energy and the interests have gone down. If I wanted to take a walk, I'm less inclined to take a walk. If I like to do some woodworking, and I'm less inclined to think of a new project. I find that human beings live and thrive on interests, and their, job is job, but hobbies and a satisfaction. The other two things, irritability and sleep loss. So, when people start to become snappy, and so snappy, withdrawn, and not sleeping worries me. Now, I don't know if that answers your question. I was trying to remain concrete about picking up the earliest signs.
And also, considering the diathesis model of mental illness, and the fact that the pandemic is a traumatic event for so many of us, could the pandemic itself precipitate the onset of a mental illness in those with the genetic vulnerability?
So this indirectly, yes, I believe so. Yes, indirectly, I believe so, because the pandemic, we're talking of a person who does not get ill with the COVID, but is affected by the pandemic.
Yes, yes.
And yes, absolutely. Just think as stress, the word stress that precipitates depression. So if I have genetic loading of depression and Julian doesn't, the same stress, given all other things equal, the same stress is likely to produce more depression in me. So yes, pandemic has been a big stress for a lot of people. They lost jobs, friends, family. I was looking at the employment rates, and right around that time, it dipped like crazy. It went so far below that it has not been in the American, last, 10 years, American history of time, last 10, 12 years. So yes, I do believe that the stress will put genetically predisposed individuals more at risk.
It sounds to me as though what we have is a whole series of webinars on this topic. In any event, we're going to have to bring this session to a close. Thank you all for your participation. Thank you, Dr. Khan. We will appreciate your feedback by completing the online evaluation you will receive. And certificates of participation, some of you are interested in that, are issued by the Wentworth-Douglass Hospital Education and Professional Development Department. And certificates will be sent out by email upon receipt of your evaluation. Now, the 2020 Spiritual Care Conference does have one more event, and the final webinar will take place on November 10. And the title is Daring to Think About Life and Death, Advanced Care Planning in COVID-19. We've already heard today about daring to think about life and death. We'll go into that a little more deeply with Sean LaFrance, who is Vice President of Population Health and Health System Integration at Cheshire Medical in Dartmouth Hitchcock. So you can find all those details if you have not signed up at wdhospital.org. We've been asked about videos for this series. So with the completion of all 4 webinars, there a YouTube video recording of each of the events will be available at the Spiritual Care webpage, which is found at wdhospital.org. With that, thank you very much, everyone, for being here. Once again, thank you, Dr. Khan. Goodbye, everybody, and be safe and sane.